When a person has chondromalacia or patellofemoral arthritis, there's an erosion of the cartilage underneath the patella and also an erosion of the cartilage on the femur that it rubs against, so the bone is rubbing on bone. Where is your pain? They say throughout the knee generally, all over. Is the pain deep or is it superficial? They usually say it feels deep underneath my kneecap. Do you have pain while you're walking or just going downstairs or upstairs? They usually say, sometimes it hurts when I walk, but it's more when I go downstairs, as opposed to when I go upstairs, which is patella tendonitis. Does your knee swell? They say yes. It's periodic, generally swells sometimes and gets better sometimes for no apparent reason. Does the weather affect your pain? Usually they say yes. It increases when it's very humid. And before I run, sometimes I feel fine, and then after I run, it will swell. So that will sometimes be another factor, will be activity. How old were you when the pain began? This usually begins when the person is at least 30. In a very young person, I would be very suspicious. I wouldn't think that that's what they had. Does it grate or grind? Usually they say yes. They know that noise. It's not a click, but it's a kind of a grating sound that occurs when they bend and also when they straighten. And you'll hear it when you do the test. The first test that reveals chondromalacia is the deep knee bend. For this test, the person gets off the table and is standing holding on to the table for balance. And you demonstrate it so the person does it correctly. With your feet roughly together, holding the table, just do a deep knee bend, allowing your heels to come off the ground and then straighten up. And I'm going to be listening to your knees as you do it. So as you do this, you're going to move with the person and your ear will be an inch from their knee. Bend down now, all the way, and come up. Now if the feet are too close, they're going to crush your hand as my hand just was crushed. So if you could put your feet a little bit apart, that's a frequent mistake. Do it again once more. Bend down. Good. And I'm following her knee. Now if I don't follow her knee, I either can't hear because I'm too far, or, try it once more, or the person comes down and smashes me in the shoulder. So you have to move with the person once more. And come on up. And you listen for crackling and grinding in the knee. The next test for chondromalacia is the patella glide. For this one, you place one hand on the thigh just to stabilize the leg. You take the palm of the other hand and place it directly on the patella. You then push posteriorly down toward the table. A little squeamish for some people, and it feels a little icky when you hear the sound. So listen for a grating. Move one direction, then the other. You're moving across the knee, taking the patella with you, and you're listening for a sound in either direction or any pain. And if you're not sure and you want to check if it's in the other leg, just lean across the table and you see if it's there. Usually chondromalacia is present in both knees, not just in one. When it's one, it's because of an accident that maybe cracked some of the cartilage. The next test you'll do, because there will be some swelling present with chondromalacia, is you'll do your passive flexion. And here, you're going to bring the heel toward the buttock very gently, and it will generally stop and be spongy, and it will hurt a little bit, so be very gentle. Then you go into extension, and this will sometimes hurt, but not all the time, and then you give a little jerk if there's no pain in this position. Then you'll do the swelling test, pressing down, seeing if there's any movement outward. Now sometimes there'll be no swelling and there'll be no limitation, but there'll be grinding and the patella press will be painful. And the story will tell you the rest. And of course, stop immediately when